Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then serum creatinine. Okay, serum creatinine. Serum creatinine, the normal range of serum creatinine is 0.5 to 1.2 milligram per ml is the normal range of serum creatinine. Here the creatinine is actually produced. This creatinine is actually produced by non-enzymatic dehydration of the muscle creatinine. When the non-enzymatic muscle degradation or dehydration of the muscle creatinine will give rise to creatinine. So muscle creatine gives rise to creatinine. So this creatinine concentration is relatively constant when compared to the blood urea nitrogen, because blood urea nitrogen can vary in high protein diets or in catabolic states. Blood urea nitrogen may vary, but in creatinine is relatively constant. So daily production of creatinine is relatively constant. So as a result, the clearance of creatinine can also be seen. This clearance of creatinine is a reliable indicator for glomerular filtration rate. Creatinine is actually a reliable indicator for glomerular filtration rate. And fine. There are one more thing. If the patient has highly muscular body, in highly muscular body, the patient may have more creatinine may be seen in highly muscular body. If the patient has thin muscle body, if the patient has thin muscle body, low creatinine levels are seen. If the patient has thin muscle body.
thank you and thank you for watching.